Ghabraman thai che. All right, che. Shh. It was just a nightmare.
I'm fine. Kainati tu suja.
Come on.
I'm not hungover.
No?
You don't know what it's going to be like. I'm a police officer, for crying out loud.
Oh, get over yourself. It's partly down to you. We're in this mess.
What? How'd you work that out?
Well, I did try and talk to you, to get you to consider the tiny possibility that you might be guilty, but would you? No.
No. I believed what she told me. I trusted her, and then she threw it all back in my face. I've washed my hands of her.
Oh, well, you wallow there with your clean hands and your self-pity. At least some of us have got the guts to face their colleagues.
Oh, yeah.
All right, Mum. I'll help you with this.
Nah, mane tari jarur nathi. Pali wadu sari rite karshe. Abara bache, tell me if I hurt you.
Up and at 'em. I've had one already. You will learn, young Skywalker, that industrial levels of caffeine taken intravenously where possible are a prerequisite for the working life of a doctor. Besides, you look like you need it.
Failing that, you could always go to bed while the hours are still in double figures.
Come on!
Enjoy.
Nama, Kaile. Nee?
You have to tell them you're not coming in.
Don't fuss.
Dad.
No, it's me. How are you, love? Did you sleep all right?
I'm fine.
Were you comfortable?
Mum, I'm fine. Look, I really need you to bring that art stuff for my exam today.
Oh, right, good, yes. What you need?
My charcoals and my pastels. They're in the tins underneath my bed. And that plastic bag full of found items. Just a small one, not the bin bag. And...
Just hang on, I'm going to get a pen.
my pencil case. And all of my rubbers. That squidgy one too.
Yeah, no.
And I need both my watercolour sets and my acrylics. They're the ones in the tubes. Oh, and there's a few of my paintbrushes over by the window. Are you still there?
Yeah, yes. Look, don't worry, I'll find it all.
And my sketch pads and my jotter.
Are you all right? तुमने शू थे यो?
नहीं, रहने दे।
अब वो यहाँ सोई जाओ।
रहने दे मने, I don't need your help।
आराम करो।
नहीं।
वो तेरे मुँह है।
ऊपर। I don't want Mum to see.
Hello. Good morning. It is Parvati Majitia. Please, we need a home visit. No, not for my mother-in-law.
Right. Get out there and you show them.
I'm sorry, Mom.
I know. But you got to put that out of your mind.
What about Dad? Can I come home?
Listen to me, Amy. All right, you messed up. Everybody's done stupid stuff in their life. And if you let this one moment of madness...
It wasn't a moment.
All right. But you've done the right thing now. And if you let an idiotic muck-up ruin your whole future, then that really would be a disaster. So if you can stand up in a courtroom and tell the truth, you can do this exam easy. And we'll all be proud.
Thanks for bringing my stuff.
Good luck.
Now, that should get it under control. But don't leave it too long next time you get a breakout.
Thank you.
Can we just stop for a minute?
Case is too complex for you?
Hardly.
If they're boring, you should be grateful that I'm whizzing them through.
No, my brain's fried. You're going too fast. They're all merging into one.
Case is too complex. I'm boring. These sound like excuses to me.
I'm not learning anything.
You are learning how to concentrate through mind-numbing tedium. So, chop chop. James Barnes.
Hi there.
Come through. You remember Dr. Wilson. She's training with us. Let's see how those drops are doing for you.
So Cherry said you can forget the mushy peas, and would you mind wearing gloves to fry my chips?
Karen, you weren't due until this afternoon, were you?
I couldn't stand rattling around at home.
Right, better get back.
Daniel, would you mind? I'd like everybody to hear this.
Sure.
Be in the papers soon, anyway. Emmy's admitted it. She's lying and stealing. So there you go. You all saw it, I didn't. Makes me a complete idiot. You can say I told you so.
Oh, Karen, come and have a seat.
She got an exam today.
She'll be fine.
Let it out. Don't hold back.
How's Rob taking it?
Don't ask.
Right, patience.
Why me? I've already got my home visits.
You have dealt with all the patients you had. I have never seen a doctor go through patients so quickly.
I'm glad you appreciate my efficiency.
She means you're too fast.
Thank you, Miss Marple. I had it covered.
Now your drop-in surgery has no patients to drop in. You are available, Dr. Carmichael. Everyone at the mill is busy.
What about Heston?
Dr. Carter is engaged in extremely important matters.
Off targets.
What's the deal with this one?
Mr. Majithia and I had an exchange of opinions when his mother was diagnosed with kidney disease a few months after they moved here from Gujarat. The man is an arrogant misogynist.
Not that we are making sweeping exaggerations or judging our patients.
He wouldn't even consider the possibility of giving her a kidney.
Living organ donation is hardly something you jump into with your boots on.
Was his mother's health not even worth thinking about? And then pressurizing his wife into being tested, for goodness sake.
Dr. Carmichael, you could have seen 3 patients in the time you have spent discussing this.
I could have seen 7.
Well, at least it'll make it more interesting.
No, this is not a good idea.
What?
A rampant sister shouting the odds is the last thing I need today. You are staying here. Good afternoon.
What is it? Have you got a date for the assessment?
Not yet, but we will have them both in for a checkup when we do.
Good. Thank you.
Today, I'm here to see you, Mr. Majithia.
तू सु विचार करे छ मैं तने कितने हालको जोडी काई विश्वास नथी
मैंने चिंता तो दी थी.
You don't need to worry about me.
Your wife was clearly concerned, or she wouldn't have phoned.
I told my wife no doctors. I haven't registered at your place or anywhere else, and I don't intend to.
I see. Well, I'm sure you have your reasons.
I'm here legally, okay? You have no business making assumptions.
Then why are you so worried about signing up with a doctor?
What's it to you?
Any GP would tell you to register so that you qualify for proper ongoing care.
I didn't ask for any kind of care.
Well, your wife did on your behalf, and now I'm here. So I'd be wasting my time if I didn't at least find out what was wrong with you.
I know what you think of me. Why would I want you as my doctor?
Well, thank you, Mr. Majithia, for making your views so clear. I will respect your wishes not to be treated by me.
You are an interfering, rude woman who makes up her mind without bothering to find out.
Do that again.
What?
Closer, say something.
Huh?
Your breath.
What?
And you're sweating. You said to the receptionist that he had vomited.
Yes, exactly.
Mr. Majithia, do you have an idea what's wrong with you?
Itching, sick, tired. It's the same as my mother-in-law's.
Do you have a rash? Please. I see. Interesting. And swelling in your feet?
You smell my breath. Called me sweaty.
Oh, it's going to get much worse than that.
Is there anything I can do?
Oh, well, that is very kind, Dr. Wilson, but I have my own systems and ways. You could do the washing up. Every 2 weeks, I get every item of crockery and cutlery and wash them thoroughly.
You do?
Oh, yes. Some of the doctors simply rinse them in lukewarm water, huh? They are strangers to proprietary cleaning products.
Maybe I could clean up some of the tumbleweed.
Doctors should be thankful when they have no patients. It means no one is ill.
Zara's got a patient. Washing up.
Oh, Dr. Carter, I would value your help.
Do tell.
Dr. Wilson is very well-meaning, but so impatient, always complaining. Dr. Carmichael is so fresh, she said. And I agree. But Dr. Wilson needs to apply herself. She needs to learn how to listen.
I'm not sure I'm the best person to be a mentor.
Well, maybe a cozy chat. Who better to pass on their wisdom?
So, Zara's too fast. What's this, a study in bacteriology?
This is not good. If only we could find something more useful to your development. Wait, now, Dr. Carter would make an excellent role model. Dr. Carter, do you think you could share some of your invaluable experience with Dr. Wilson here? You can see how dedicated she is.
Oh, indeed, commendable.
Well, that is settled then.
Let's go for a walk.
What if we get some patients?
We'll maintain radio contact. Now, there are masses of cases I can talk you through.
Where are the kidneys? They are here?
Yes, that's right, and another one on the other side.
My husband is a good man. You should not speak that way to him.
Well, maybe he shouldn't speak that way to me. Or to you.
You have no idea, Doctor.
What about your little boy? Imagine when he's grown up, if you really needed his help and he wouldn't even talk to you about it.
You have no respect for your patients, talking about them behind their back.
If you don't like my opinion, maybe you should rethink your attitude. I call things as I see them.
Oh, and you've seen enough evidence to rush to judgment?
All I have done is try to do the best for your mother. It's a pity that the same thing can't be said for you.
That's it. I won't have you in my house a moment longer.
Don't worry.
No, you must stay. He only has one kidney.
Mrs. Blakely's history was fairly normal for someone her age. She was quite frail, arthritis, varicose veins, a tendency to get chest infections, but no real history of stomach problems. Am I boring you?
No. No.
Going a bit slow?
Zara. Oh, Queen of the Marigolds.
Patients can be fast, they can be incredibly slow, they can skirt around the issue in subtext, or they can tell you what they want and how to be treated. They can bore you to death with something mundane and then drop a bomb just as they're leaving. The important thing is that you listen and you concentrate. Have you been doing that?
Sure.
What would you recommend for Mrs. Blakely?
গায়ে পাঞ্চে তুসু বলেছে
એટલે તો શું કહી રહી છે પલ્લી એના તેની એક કિડની વેચી નાખી છે મને ખાતરી છે
ચૂપ થઈ જા
He sold it. Mohan went from our village to work. It was not long and he is back with a scar there. He said an accident in his new job.
You knew, you guessed all this time and you said nothing.
I saw you were ashamed.
So you respect my privacy, now you want to tell the whole world?
Your wife knows that you're ill.
એટલે એને આ રીતે પૈસા ઉપજાવ્યા હતા.
I didn't want her to know.
That is why I wanted it to be me. To give her a kidney. To thank him for bringing us here. Away from the fever. Giving this new baby a hope. A future. Hope for us all.
I misjudged the situation.
Is that what passes for an apology over here?
So, you're going to lick your wounds and fade away into the corner. If it is your kidney, and we don't treat it, you could die.
It was my choice.
Oh, so you deserve it. There is plenty that we can do.
Don't bother.
Okay, I get it. You don't want anyone to know, you don't want help, but your body has kind of overruled that, hasn't it? Is it so bad if your family know how you got this money? Your wife is right. You're a good man.
A good man would be able to support his family by working. What was I supposed to do? Watch another baby die?
And your mother? How would she have gone on when she got ill if you hadn't come here?
My mother shares your opinion. What a selfish son. How ungrateful not to give her a kidney. I would have hacked it out with a penknife if I thought it could have helped her.
Well, she knows now.
They were never meant to know.
Oh, get over yourself. This is pure pride. You have given up everything to earn your family a better life. Are you too big to benefit from that yourself?
Pride. I suppose you'd know about that, wouldn't you?
Possibly. But we're not talking about me. You have to stop this tragic posturing. Look at what you've achieved. The promise your life has now. Apart from this one big thing that's eating you up. And now it's out in the open. You can deal with it.
Thank you. Thank you. I am so sorry. મને તો જરાય ખબર નથી બેટા. મને માફ કરી દે દીકરા.
માં માફ માગોની કાંઈ જરૂર નથી. તમે માફ ના માગો.
Please. Look after him, doctor.
Of course. We'll be in touch with an appointment. And it doesn't have to be with me. It can be with a male doctor, if you prefer.
Any doctor with less attitude.
But I will ask for you, doctor. And I will come soon.
You see, she has a mind of her own.
I never said she didn't.
Passive Indian wife. Admitted you thought I had forced her into an organ donation.
I do not now wish to donate a kidney to my mother-in-law. Please to test if I am a match with my husband.
Pali, tu શું વાત કરે છે આ? David ના થાય. You mustn't. Mum needs it.
And you don't? Yes. Yes. He will have it now. Please, doctor.
Ma.
Shanta, my dikra. Shanta.
Zara is an excellent person to study because she's frighteningly competent. Challenge yourself to get to the diagnosis first.
Spot if she's missed something.
Right. The case may be more interesting than you think.
OK, Mrs. Blakely, let's try this again. Perpetual stomach upset. She's elderly. Any weight loss?
No.
Hang on, you said she got arthritis.
I did, and getting worse recently.
What's she taking for it?
Ibuprofen.
Ah, started taking it at the same time as the stomach problems?
Duty calls. Let's put your new skills into action.
You were so sure, weren't you? And you were right. My daughter is a thief. You can say what you like, because I'm standing by her.
Oh, my dear. Theft is something she has done. It does not define her. Imogen is still your precious child, and you must not be afraid to love her unconditionally.
Yes, right. Well, she told the truth, and I'm proud of her.
Quite right. She will have learnt much, though the lesson has been hard.
Right, well, thanks.
Anytime. I have been told I am a good listener.
It was interesting to see the difference in your consulting styles.
Glean the best of both.
And who'd have thought it? I have been learning from Zara.
Don't worry, I won't tell her.
This is nice.
As long as you're patient and listening, you'll always get to the diagnosis. You were wonderful with Mrs. Owens and her urine.
Taking over my role, Heston. You're not trying to switch mentors, are you?
I'll give you another chance.
Don't get cocky. Come on, I'll take you through the Magithia case. There's a twist in the tale. And don't worry, I'll take it slowly.
Oh, no, it's cool. You go as fast as you like.
I'm so glad you're here. There's something
I know. Jimmy told me.
I'm so sorry, all the things that I said.
Forget it.
Yeah, but if I'd have let myself listen to the things that you were saying, maybe it wouldn't have got this far.
How is Emmy?
I don't know. She's in an exam today. But it's Rob. I've never seen him like this before, and I don't know where it's going to end. And can't ask Brian and his wife to put up with her moping about their place for much longer.
Why doesn't she come and stay with me and Jimmy?
Oh, no, I could...
No arguments. I'll pick her up after school, we'll come by yours, we'll get her bits and pieces, we'll get her through these exams together. She's brilliant at heart, she'll be fine.
Yeah, that's what I keep telling myself.
5 minutes, everyone.
Yes?
Ashwipe.
Excuse me?
D.A. Morris. I'd be looking after Sean Noble from here on in.
Well, you know that he's got facial injuries and possible concussion?
As long as he can talk, that's all right with me.
How is Rob?
Well, I wouldn't want to be the criminal that gets in his way today.
I wasn't fighting. I was fighting back.
Save it for the judge.
Under staffing level